Well, each year, osteoporosis causes around 2 million broken bones in the U.S. alone and threatens 1 out of 2 women over the age of 50. A new survey shows while 3/4 of Americans say they are aware of the effects that osteoporosis can have on their health, only about half of those surveyed reported taking any steps to prevent it. Well, May is National Osteoporosis Month, and I have Dr. Andrea Singer, Clinical Director of the National Osteoporosis Foundation, with me to share important steps for improving bone health and preventing osteoporosis. Thank you so much for joining me today.
It's my pleasure to be here.
Now, first, doctor, tell us a little bit more about osteoporosis.
Well, 54 million Americans either have osteoporosis or are at risk for the disease. Osteoporosis is a disease that causes low bone density, which leads to weaker bones, making them more likely to fracture or break.
And who is at risk for developing this condition?
Both men and women are at risk for developing osteoporosis. There are a number of risk factors that increases one's likelihood of developing the disease and breaking a bone. Those include age. This is a disease that increases with increasing age. Genetics or family history, especially the history of a hip fracture in either mom or dad. Being small or having a low body weight, because that often means that people have smaller bones. Smoking or excessive alcohol intake. Not getting enough calcium or vitamin D in, or being inactive. And there are certain diseases or medications that can increase the risk for osteoporosis as well. Perhaps most importantly, if somebody has had a prior broken bone, that significantly increases their risk for a future bone break.
Oh, wow, that's good information to know. Now, is there anything that people, particularly women, can do to lower their risk of developing osteoporosis?
There are a number of things that women can do to lower the risk of developing osteoporosis. A bone health plan, being involved in one's own health, includes things like a well-balanced, healthy diet, making sure that people are getting enough calcium and vitamin D in, as well as fruits and vegetables and other healthy components to the diet, weight-bearing, muscle-strengthening exercise, and avoiding the risk for falls are also important. I think it's important for women to take charge of their health and to speak with their healthcare provider about whether or not they're at risk, and to ask if they're appropriate to have a bone density test or a DEXA scan to assess that risk.
Now, you just mentioned a bone density scan. A lot of people have heard about that. Can you share with us what that is exactly and who should consider getting one?
So a DEXA scan, or bone mineral density test, is a painless, non-invasive, quick test that helps us look or measure bone mineral density, and by doing so, predict the risk for osteoporosis and a broken bone or fracture. The National Osteoporosis Foundation recommends that all women over 65 and men over 70 should have a DEXA scan. Younger postmenopausal women and men under 70 who have additional risk factors should also be considered for a scan. So it's important that patients speak with their healthcare providers to determine if they are a candidate to have a bone density test.
Absolutely. And then lastly, doctor, where can people go to find out more information?
If people would like more information, they can visit boneawareness.com, which has some wonderful resources and additional information beyond what we've spoken about.
Great, thank you so much. And for a full list of risk factors of osteoporosis, along with more information about the condition, visit www.boneawareness.com. Thank you so much, doctor. It's been a pleasure.
Thanks for having me.
Have a wonderful day.